we said that there are different types of prostheses or different types of elbow arthroplasties available. So depending on the rigidity of fixation, they can be classified into the fully constrained, semi-constrained, and the unconstrained prostheses. So if you go into history of elbow arthroplasty, it started with the fully constrained type of prostheses like these. The Stanmore design was one of the first ones to come up. So they had a metal to metal hinge with your normal PMMA cement fixation. But problem was that they didn't allow any degree of valgus, varus, or rotatory motion. So very high loads, and because the patient was using his arm for forearm and arm for rotations and some amount of varus valgus, and so these type of prostheses were they were a lot of loads were exerted on these types of prostheses, and they had a very high and early failure rate. So these are no more used because they failed, they loosened up or broke very fast. The commonly used one these days are the semi-constrained prostheses. The most commonly known, well known, is the Conrad Moray prosthesis, which is available in India also. This is a two-part or three-part prosthesis. You have the humeral component, which may have an anterior flange. You have a ulnar component, and these two are linked with a pin-like device. So these are metal to high density polyethylene articulation with a locking pin or snap fit device. What is different from the fully constrained prostheses is that they have a built-in varus valgus laxity for side-to-side dissipation of forces. So less amount of loads are exerted on these as compared to your fully constrained prostheses, and have shown a longer durability and longevity as compared to your fully constrained prostheses. We also have unconstrained prostheses like these ones. These are two-part prostheses, and they have metal to high density polyethylene articulation, which may usually have a snap fit design. So you have a humeral component and resurfacing devices, and these are usually not linked so that they can duplicate the anatomical surfaces of your elbow. What is different from your normal or the more commonly used semi-constrained prostheses is that these require a normal intact ligament. So you need your collateral ligaments to be intact to provide stability in these type of surfaces prostheses.